I honestly don't remember a day of my life where I wasn't sick or I wasn't in pain. At 5 years old, I had my first surgery, and then at 14, I was diagnosed with a rare blood disorder. And then after that, the diagnoses kept coming. And every diagnosis I got, I thought, okay, things will get better now. And they never did. I think I would have been stuck in clinical care for a long time if I hadn't moved here. So I came over to Stanford. And since then, I've been able to participate in research and do things that I normally wouldn't have had access to.
The FPOP study is where we use deep data to solve unsolved diseases. They can't understand what's going wrong with them. To say the least, it's extremely disconcerting. And so they turn to us to use deep data to try and get a better picture of what's going on with someone's health. And so that involves sequencing their DNA, doing deep profiles out of their blood and urine, even their microbiome we'll often look at. Traditionally, if you go to a physician's office, they actually don't measure very many things. One analogy I like to use is that if your health is a 1,000-piece jigsaw puzzle, we're trying to get 500 or 600 pieces to better understand what that picture looks like. And by today's measurements, that would be like 5 or 6 pieces, what we currently do.
For so long, we've looked at my care as very separated and pieced out and very siloed. And being in this study and having this multi-omic approach, this is the first time that we'll be able to take information from all of these different places and put together a better picture of my own health.
We are enrolling people in a research study because it goes outside of what's clinically normal. My own personal belief is that the person who should have access to data is the patient. There's nobody who's going to spend as much time on you as you or your family members. And so I'm a believer getting access to information so that you can make the best diagnosis for yourself.
I've been involved in a lot of research studies, and the benefit to being in this one is that all of my information has been going directly into my medical records. Out of all of the studies I've participated in, I have never gotten information back, and I've never gotten anything that my physicians could use. And so what I'm really looking forward to is being able for patients to have access to that type of data, to spark research and innovation in a way that it never has before. And I think that's where we're going in the future, right? To have this data that even if I, as a patient, don't fully understand it, I can put it into the hands of somebody who does.
In the big picture, we need to be sharing all this data. And the more open it is, the better off it is. Because we're trying to set up signatures, if you will, for every single human disease. That will be the ultimate goal. So that when you do get a case that you've never seen before, you do a profile, you say, well, that looks a lot like that disease. And by the way, they did that treatment and that helped them. So maybe that person should do that treatment. That would be the goal. It's a data problem. It's very solvable. Just get enough data, you should be able to solve every disease.
I'm more hopeful now than I ever have been in the last 48 years of all of this. Working with research to the people and being enrolled in Dr. Snyder's lab, where I see technology developing and innovation happening that could, maybe even if it's not for me, but potentially change the life of someone else. I think that's one of the things I'm just really excited about.